Alright guys, this is the first chapter to the new textbook, the electronic health record for the physician's office. Now this book runs hand in hand with sim charts for the medical office, which we use here on campus. So this is a really good resource, and if you are working towards your electronic health record certification, this is the textbook that you really need to dissect and to digest and really understand what's going on here. So we're going to start with chapter 1 today, and it's the introduction to the electronic health record. Some of the things that we're going to talk about today are just going to be able to explore the history and current use of patient health records and their importance to individuals' health and their contribution to the healthcare network. Become familiar with the content of a typical EHR system. We'll define documentation and explain who documents in the medical record. We'll discuss the ownership of a health record. We'll list and explain 8 core functions of the EHR, and we'll describe the basic functions and advanced clinical support decision software features of the EHR system. We'll define practice management software and explain how it is used with an EHR system. We'll discuss and describe advantages and disadvantages of an EHR system. We'll discuss EHR adoption rates and who is using an EHR system. We'll identify the roles of various healthcare professionals in the implementation of an EHR system, and we'll investigate various professional organizations promoting the use of EHR systems. So as most of us can gather, and as you probably know, technology nowadays is taking over, and everything is turning over to the electronic format, even medical records, and that's what this is all about. So we should be past the transition stage now of transitioning from paper medical records to electronic medical records. However, you might have a straggler or two there that will still be using the paper-based medical record system. So basically, what is a medical record? A medical record is a physical collection of an individual's healthcare information. Now, it can be everything and anything that goes on with that person health-wise. And they've been used throughout history to document patient healthcare, signs and symptoms, diseases, and trends of diseases. Now, you first noticed health records being used way back in like 200 BC or something like that, and it was some physician from China who just basically kept notes on the people that he was seeing. And that's basically your first and most simple form of a health record. And then it really started to kick off in like 1892 to 1954 when Ellis Island was open, and all of these immigrants were coming to America to make America their home. And medical records were starting to take documents, or they started to make documents into medical records to make sure that people were free of any communicable diseases, like you see on the bottom one here. And that's really where it started. And then you can also see Hitler used them, and not for the right purposes, but he wanted to see the effects of how different types of chemicals and gases affected the human body, so they kept notes on those things. So generally, the keeping of medical records has been a really good thing for the medical field. However, as anything in this world, there are a couple bad eggs there. But nowadays, everything is looking good, and medical records are being used for the right purposes. So what is in an electronic health record? What is the content? What is the guts of it? So basically, each patient has their own record, and it's just a compilation of everything that patient has done health-wise. And its documentation is a vital component of an EHR system, and it's important to note that everything is accurate and precise in that medical documentation. It can contain health information, administrative information, and even legal documents. And we'll get into each one of those here in a bit, but it's important to know that. So some of the clinical information that can be seen in there. You can have medication lists. So what types of medications do you take? Do you take something for your diabetes, or are you anemic? Okay, and they put that in there. Are you allergic to anything? If they document that. Immunization records. Have you ever been immunized with anything? The Hep B vaccination or something like that. Laboratory reports. So anytime you got blood drawn, or you had a throat culture when you had a strep throat, those would all be in there. Pathology reports. Anytime you had surgery or surgical reports, hospital reports. H&P is your history and physical examination. Okay, every time you go to the doctor and they ask you questions, okay, those are going to be there. Your progress notes, your radiology reports, X-rays, those types of things. So those are all. Everything that happens is going to be in a medical record. It'll also have administrative information for you about patient information forms. And that's basically asking you, the first time you go to the doctor's office, and they give you a clipboard with a bunch of papers on it and say, here, can you fill this out? And you have to check all the boxes, yes or no, if you ever had this, that, or the other thing. that is a patient information form. They're just trying to gather all the information they can on you to establish your health record. It can be referral letters sent from another doctor. If you work at a specialty clinic or you're referring them to a specialty clinic, you need to have referral letters and consultation letters. It will have insurance information and billing information, their appointment history. They have diagnostic and procedural codes, which I know you don't know much about now, but you will know in the future. And you'll have emergency contact information in there as well. So it covers everything. And then the legal documents. Okay? So on occasion, a patient medical record may be used during court proceedings for malpractice lawsuits. Thorough and accurate documentation helps prove what, when, and why something happened. So documentation, guys, is key. I know we talked about it in your medicine and law and medicine and ethics sections in the administrative medical textbook. Okay, but documentation is so essential to our job as administrative assistants in the medical field. If you want to see a consent form, look at figure 112 in the textbook, and you can see it there. And on the sim chart for the medical office, if you click on the form repository button or icon there, you can basically go in and review forms listed on the left side panel into legal, administrative, and clinical documents, and there will be a ton of them there, and we'll get into that more in the future here. But some of the legal documents you might see are going to be a medical records release form or an informed consent document. You can have HIPAA forms, advanced directives, living wills, insurance authorization forms, and healthcare power of attorney forms. So there's a ton of forms, guys, that all are going to be essential in the delivery of healthcare to your patients. So some of the documents for documenters for a medical record. So what I want you to do here is just think about the type of health career that you have chosen to venture into, whether it's just a medical administrative assistant, whether it's you looking into being a medical administrative assistant with electronic health records or billing and coding, or you want to do it all. Just think about this when you're doing this, okay? So individuals who are responsible for inputting information into the medical record are known as the documenters, okay? They can be receptionists, they can be medical assistants, physicians, or other treating professionals, and medical billers. So really, it's everybody in that medical office needs to be able to utilize these electronic health records. And it's structured data entry and free text documentation. So a lot of it's going to be templates where you just input data into these templates and check boxes and click radio buttons. But some of it you're going to have to type in and do that free text documentation as well. So it's a mixture of both. Ownership of the medical record. All right, this is a good one to know, and it's really important. This question will come up a million times. Who owns the medical record? Okay? Now, it's the property of the individual who created it. Therefore, the physician's office owns the medical record. Now, the patient owns the information in the medical record, but the physician owns the actual physical record. Okay? Now, the patient can obtain a copy by signing a records release form and pulling that information. However, they may be charged administrative fees for having to go through the processes and get that all done. Now, there is such things called as doctrine of professional discretion. Okay? So basically, this is a principle that states that a physician can exercise his or her best judgment when deciding whether to share progress notes and clinical observations with a patient who is being treated for mental or emotional disturbances. The doctrine of professional discretion is intended to protect mentally or emotionally ill patients from any additional harm that viewing their medical records could cause. So, if you're dealing with a patient that has mental or emotional issues or disturbances, it might be in the best interest to that patient to withhold some information from them, and that is known as the doctrine of professional discretion. So let's look a little bit more into the electronic health record. So the patient medical record is in an electronic form now, and you'll see when we get into the actual sim charts, which you'll start playing around with more next chapter, and you get into that, you'll see that everything is there, everything is housed there. So ideally, the EHR can exchange data freely with other computer systems, such as other healthcare providers, pharmacies, hospitals, laboratories, and insurance companies, creating one central electronic health record that is easily accessible to authorized parties, yet secure enough from those who don't have the right to see it. Okay? And there are 8 core functions of an EHR system. If you look on this slide, here they are, and we'll go over them a little bit more here. But in 2003, the U.S. Department of Health and Human Services, or DHHS, asked the Institute of Medicine to create a set of standards for EHR systems. In response, the IOM, or the Institute of Medicine, outlined these 8 core functions of an EHR system. All right, and that's health information and data management. You have results management, order management, decision support, electronic communication and connectivity, patient support, administrative processes, and reporting and population health. So what I want you guys to do is look on page 10 in your electronic health records textbooks for more details on each of those 8 functions and really educate yourself on these points, okay? Now, medical records weren't always electronic. We never had the technology available to us to have that luxury of having them. So there is a transition period from transitioning from paper to electronic records. So the Bush administration, okay, back when President Bush was in office, declared 2004 to 2014 the decade of HIT, or HIT. Now what does HIT stand for? It stands for Health Information Technology, if you look on the next line right there. Okay, so the Office of the National Coordinator of the Health Information Technology, or the ONCIT, promotes universal meaningful use of EHR. So for example, computerized physician order entries, CPOE, they developed and established that. And they were really ones that started to push from the transition from paper medical records to electronic medical records. Now, there is a difference between electronic health records and electronic medical records. All right? So the terms EMR and EHR tend to be used interchangeably, however, there is a difference. So if you were trying to explain this to somebody who has never heard the difference, the easiest way to do that is to say that an EMR system is the electronic patient record created and maintained by a single provider, where an EHR system is interconnected aggregate of all the patient's health records, so it's everything and it can be shared to multiple sources. All right, so the EHR system is interconnected aggregate of all patients' health records. It has data from multiple providers and the data from multiple healthcare facilities, where the EMR system is the electronic patient record created and maintained by a single provider. Okay. So here are some basic functions of an EHR system. So most EHR systems have some basic functionality with differences in task execution, navigation, workflow, and so forth. Because their fundamental features are similar, the user can adapt to different systems with very little difficulty. So if you guys become proficient and efficient here on Center using sim charts, no matter what medical office you go to, you shouldn't have a terrible time transitioning to their program. So the sim chart for the medical office, which is called CMOE, or SCMO, I'm sorry, is a web-based EHR that has real functionality used in physicians' offices and outpatient facilities while giving you guys, the students, a safe and academic learning environment. It will be referred to throughout this text, and we really go hand in hand with that. You guys will be using sim charts a ton throughout the entire medical office program here. So really grasp it, really try to understand the concepts. And if I were to give you a task and say, can you do this for me, I want you to be able to, by the time you leave here on Center, be able to just jump on that EHR system and navigate it and execute that task presented to you. So here's some basic EHR functions. You can do progress notes. There's documentation templates, whether it's a certificate to return to work or something along those lines. You have provider review of incoming data. You'll have an images attachment. You'll be able to have an electronic signature insertion. You'll have prescription templates. You'll have faxing and messaging, patient reminders, vital signs data. You'll have importation of data. You'll have automatic flagging, emailing from there, printing from there. So it really will do everything that you need to have to make your office run efficiently. So clinical decision support, or CDS. So basically this allows providers to set protocol for specific patients and or conditions. Now, the CDS tool will only work if the provider takes advantage of them. So, but based on evidence-based treatment protocols, it basically gives the patients automated preventative care reminders. It will set up treatment plan templates. It will generate patient data reports, and it will have more documentation templates for you as well. This is a really good thing that you want your physicians to be involved in. It really helps bridge that gap between the patient and physician, and it offers them that documentation and support that they should be easily able to understand and use at their benefit. And then you have practice management software, and basically practice management software allows the electronic management of the business side of the practice. So this is really where we focus on as administrative medical assistant. So you'll have some administrative software used for patient demographics, and then you'll get into billing and insurance information, scheduling their appointments, and then you have advanced accounting procedures. So these tasks are now incorporated as part of the EHR. I know it's really hard to see on here, okay? But here are some administrative source documenting. This right here is a, let me see if I can see. Oh, this is just a patient information form. So this is something, a template that you would get on and just fill out the blocks, with a patient information form. Adding their last name, they're basically their demographic information, their insurance carriers, their driver's license, their social security number, those types of things here. So an SCMO, so a SIM chart for the medical office patient demographic screen is still shown here. And basically, the patient demographics tool in the SIM chart for the medical office stores all of the information on 3 tabs, whether it's the patient, the guarantor, and insurance tabs. And you guys will have plenty of time to get in there and play with that and learn more about those there. Some advantages of EHR systems. So why is it good to have electronic health records in your physician's office or in your hospital? And basically there's many reasons. It's improved quality and continuity. So it's improved quality and continuity of care. So management of chronic diseases and disaster preparedness, it really helps make those more efficient. It's increased efficiency, it's improved documentation, it's easier accessibility at the point of care, there's better security, it reduces overall expenses of the practice, and it makes your job and the patient's job more satisfactory. But the one that sticks out the most as the most advantageous and most important to the patient would be the valued improved quality and continuity of care, as well as the improved efficiency of visits. Getting their time in there, moving quickly, getting a lot done in a short amount of time really will help that patient and their morale throughout that doctor's appointment. Now, continuity of care is the transition from one physician to another of a patient. So if a patient comes to you and you need to refer them out to another provider to see a specialist of some sort, having that bridge of the electronic health records, and just being able to send them that electronic health record or release some information to them really helps them pick up right where you left off and continue that care for the patient. Some disadvantages though, so there are a couple. Compatibility standards have not yet been universally applied to ensure that systems can interact with or talk to one another. So this capability is known as interoperability. So the lack of interoperability among some products. So some medical electronic health records might not talk to other electronic health records, and that could be a disadvantage of that for sure. So this is a lack of uniformity that has become a real dilemma for both the individual patients and for the U.S. healthcare system as a whole. If a hospital uses a different EHR system from that of the patient's primary care physician, the patient's health records may not be available to the hospital or vice versa. Some other ones which are less disadvantageous, I guess, would be initial cost. It's a big financial investment to get this up and running, and then it takes a lot of time to implement it as well. Employer resistance. You might have those employees that are comfortable with their jobs and the way that things were going with the paper medical records, and they might not want that change. Regimentation and security gaps are a couple more. So early versus late adopters. So mainly, a recent large study showed that those most likely to have adopted EHRs early were primary care physicians, physicians practicing in large groups, and specialists. Generally, recent healthcare graduates are more likely to report overall satisfaction with EHR usage because that's the way they learned throughout their college courses or throughout their educational experience. Yeah, they've used technology to their advantage. So being able to transition, having a college-age student transition into using EHR systems now is easy for them. So the following factors could affect user satisfaction. The length of systems response time, so if your computer is slow, the perception of workflow logic, okay, ability to complete tasks, ease of mistake correction, training time, availability of support staff, system effect on quality of care, ability to convert systems to specific provider needs, and a level of computer skills. So those will all play a factor in how satisfied you are with EHR systems. So the roles of healthcare professionals. The EHR has many users within the healthcare environment, and it will have an effect on all areas of the medical office. Physicians, nurses, physician assistants, medical assistants, and medical coders and billers all must be exposed to the EHR. All right? And although learning new software may be difficult and time-consuming, it is important to keep patient care front and center at all times, as yes, they are the reason why we treat patients every day. So some of the basic skills you need to know. You need to have knowledge of medical terminology. All right? Every part of healthcare is important, and this is no exception. You need to be able to understand the medical language, and if you don't understand the medical language, you're going to really struggle through this. Basic typing and computer skills. Yes, you need to get comfortable. It takes time, but you can get it, and everything is electronic now, so if you don't like using technology and electronics, this might not be the field for you. Organizational skills, okay? You need to prepare yourself to go paperless, because everything is getting paperless. Even checking in with the doctor and the doctor's notes in the exam room, okay? Those are being done on iPads now and different things like that. And then you need to have interpersonal skills. You need to be able to help patients through this transition too, because you might get an older geriatric patient that comes in and has never seen an iPad before, and you ask them to register on it, and they're wondering what exactly you're typing in and who you're sending it to, and so you need to help the patients through that transition and really try to ease it and make it easy for yourself. Some administrative duties that you're going to see. So we had administrative, we had clinical, and we had legal duties at the very beginning. Now we're going to get into each one of these. So the adoption of an EHR system affects many of the administrative duties within the medical office. Medical office personnel will need to adapt to these changes to ensure smooth transition from paper-based records to EHR systems. The EHR is purchased in a generic format, and it must be customized to fit the given office. An orthopedic office might not have the same information and setup as a gynecology office. So it really just depends on what the purpose of your office is. Doing so represents a large chunk of administrative work in the medical office. So here are some of the duties that can be done on EHR systems for the administrative aspect. We have receptionist duties, appointment scheduling, electronic chart creation, purging, entering patient data, creating patient letters, email communications, patient education, and then the coordination of care. Some clinical duties, okay? So the EHR can be customized to ensure that all components of the patient's visit are well documented. So you can document treatments, you can coordinate patient care, and then you can document their patient history and physical examinations, their vital signs, their progress notes, which are basically details of the patient's visit. We can talk about laboratory requisitions, prescriptions, test results. All that stuff is going to be stored in an electronic health record, guys. And then some billing and coding duties that you're going to have to do. So a fully integrated EHR and practice management system allows the user to review the clinical documentation that we just talked about and then prepare claims for submission off of it. So data from patient demographics and superbill or encounter forms are populated into the insurance claim and then sent out for reimbursement to the medical office for the services rendered. So you'll be able to create billing statements. You'll sign procedural and diagnostic codes. You'll link codes for reimbursement, do auditing, and filing patient statements. So really, guys, everything that happens in the medical office is going to be documented and shown on this electronic health record. And as I said earlier, it is essential to have good documentation skills because that is our job as medical administrative assistants. Okay, everything is about documentation, making sure everything is correct and well organized, and that is probably the most important thing in our job, other than confidentiality here. So professional organizations now. There's many benefits to becoming involved with professional organizations. They can offer you other certification exams. They can give you CEU opportunities or continuing education units. There's chances for networking and getting yourself out there as a medical administrative assistant and maybe growing through the career field there. There's newsletters and professional journals that are sent out. You'll have discounts on publications. You'll sponsor conferences, workshops, and web-based activities. So learning should be lifelong, especially in a constantly changing environment like healthcare. So getting involved in these professional organizations here will really help bridge that gap between your learning here and then your learning 15 or 20 years down the road, okay? So get involved in one of these or multiple of these professional organizations after you leave this program here and really continue your education. You have AHIMA here, which is the American Health Information Management Association. You have American Academy of Professional Coders, which is the AAPC. You'll have the American Association for Medical Assistants, the AAMA, or the AMT, which is the American Medical Technologists group there. And that is going to end our slide for today. If you have any questions, please feel free to come ask me up here. I'm more than willing to help in any way that I can. Really try to digest this information that's presented to you guys, and use this lecture to just reinforce the book. Okay, this lecture is just an outline of the material that's covered in the book. You really need to get in there and to try to dig deeper and dive deeper into that information. All right, have fun and good luck, guys.